Hi, my name is Dr. Paul Williams. I'm a gastroenterologist with Baptist Health. March is Colorectal Cancer Awareness Month. This annual reminder is important for several reasons. More than 100,000 cases of colorectal cancer are diagnosed yearly. Colorectal cancer is the third most common cancer behind lung cancer and breast cancer. 25% of the men and greater than 16% of the women that we do a colonoscopy on will have a polyp. Polyps are little grape-like growths that occur in the colon, and this is where cancer starts. If we find the polyp, we can remove it. This is why colorectal cancer is called a preventable cancer. We find the polyp, we remove it, and we remove the chance of cancer forming within the polyp. Unfortunately, it's estimated that only 50% of those eligible for colon cancer screenings will actually follow through and have their procedure performed. When I talk with patients about colorectal cancer screening, they have several questions that are commonly asked. The first one is, what exactly is colon cancer screening? This is simply a process of looking inside the colon with different modalities to search for colon polyps or small tumors. The next question I'm always asked is, well, who should be screened for colorectal cancer? This is an easy answer. The answer is everyone. Everyone starting at the age of 45 should have a screening colon exam. And this is for the average risk individual. Average risk means that you are someone that does not have a prior history of colon polyps or cancer, and you do not have a first-degree relative with colon polyps or cancer. Remember, a first-degree relative means father, mother, brother, sister, son, or daughter. Next question is, but what if I do have a family history of colon cancer or polyps? When do I have my first exam? If you have a first-degree relative with colon cancer diagnosed prior to the age of 60, then you should have your first exam at the age of 40 or 10 years younger than the age of the diagnosis of the colon cancer. For example, if you have a first-degree relative with colon cancer and they are found to have colon cancer at the age of 46, then you should have your first colon exam at the age of 36. Another question is, how exactly is colorectal cancer screening performed? There are several different modalities. First I'm going to talk about is colonoscopy. This is the gold standard for colorectal cancer screening. This is where we place a flexible, lighted tube in the colon and we examine the entire colon visually. This is both a diagnostic and therapeutic tool, meaning if we find a polyp or if we find a little tumor, we can biopsy it or remove it at that same time. This does require a bowel prep to be performed. The procedure is safe and comfortable with the use of sedation. The next modality is called air contrast barium enema. This has been around for a long time. This is a radiographic procedure where contrast is instilled in the colon and x-rays are taken looking for polyps. It does require a bowel prep to be performed. No sedation is used, and if a polyp is found, the patient will need to be referred for a colonoscopy to have that polyp removed. The next modality is CT colonography. This is a special CT scan where contrast is injected into the colon and images are taken of the entire colon looking for any polyps. This does require a bowel prep to be performed. Sedation is not used, and if a polyp is seen, then that patient will need to be referred for a colonoscopy to have the polyp removed. The last, and probably one people hear about most commonly now, is called Cologuard. Cologuard is a procedure that you do at home. It's where you take a small stool sample, send it off to a specialty lab that looks for cells within the stool that is shed from colon polyps or cancer. This is a new DNA technology, and if the test is positive, then the patient will need to be referred for a colonoscopy to look for a polyp or a colon cancer. This test does require a prescription from your physician, and it is covered by Medicare and most insurance companies for average risk individuals. Remember, that is the patient that does not have a family history of colon polyps or cancer, and they themselves have never had colon polyps or cancer. Medicare will pay for this for every 3 years to be performed after the age of 50. Another question is, if I do have a polyp or cancer, how often should I receive colon cancer screening? If you're that average risk individual and you have a colonoscopy and no polyps are found, and you have no family history of colon polyps or cancer, then it's once every 10 years. If a polyp is found in your colon when we do the colonoscopy, then we do it every 3 years until we have no polyps found. If you have a first-degree relative with colon cancer, then after your first colon exam, it's every 5 years thereafter. And that's whenever you start receiving your colon exams, it's 5 years thereafter. So in summary, colorectal cancer is a very common cancer, but it is preventable and potentially curable with screening and early intervention. Everyone, and that's the most important thing, is everyone should have colon cancer screening starting at the age of 45 or younger if there is a family history of colon cancer. Colonoscopy is the gold standard for screening because it is both diagnostic and therapeutic, meaning if we find the polyp, we can remove it at the same time. If you have questions or concerns, please talk to your physician and get answers. If you need to schedule your colon exam, please call Baptist Health Gastroenterology at 501-219-0721. Thank you.